Assalamu alaikum. Welcome everyone on board. Today we will discuss this topic of post-operative nausea, vomiting, and aspiration. So before we start, if anyone wants to ask any question from previous discussion, any query or any comment. Yes, Abdul Rafiq.
Sorry, sir, no such question in mind.
Okay. Have anyone of you faced this complication of aspiration?
Yes, sir, a few times.
Few times. Means in what shape? Aspiration. So what were the problems at that time?
Sir, like in one case during my first year, at night time, a patient came. I think he was a boy of 2 or 3 years of age. And we confirmed from the father that the patient had complete NPO.
NPO was
The
actually exactly what happened when you faced what
Yes, sir.
happened.
Okay, sir. Sir, exactly this happened that the surgeons wanted to suture a wound on the tongue. So the plan by my senior resident was made that he was going to, anesthetize the patient with mask, and when the patient was deep enough, he was going to allow the surgeons to repair it. So just at the second attempt the surgeons were making, it started to get really difficult to ventilate the patient. That was the first issue that arose, and then the senior resident told someone
Oh,
to get an hygienist.
so it was
And
it was an emergency case, and you were
yes, sir.
trying to do a case with mask. Okay. So
Yes, sir.
so we will
That's what happened.
start our discussion with this point that the biggest factor when we have respiration is lower esophageal sphincter tone. Okay. So that's a physiological sphincter, and actually when you were trying to ventilate the pressure, there was increased airway pressure, increased pressure which you are giving. Okay. So it has probably opened this lower esophageal sphincter and the aspiration had occurred. Okay. So, did the patient after that immediately had some decrease in saturation?
Yes, sir.
Okay. And did the patient need to be remain intubated?
Yes, sir. First, at that immediate time, the patient was intubated. Then the tube was soiled by particles from the vomiting. So then the ETT was changed and the patient was sent to the ICU intubated.
Okay, so so actually the real time, what happens that when if you are trying to for example, because now I will just try to sum up by that how like what happens when we try to prevent from aspiration. Actually there are one liquid content, okay, and then one solid content. So even if we have done aspiration via NG tube, okay. So what happens that you can aspirate this liquid, but solid will remain. Okay. So this is one problem. And when you put NG, the problem will be that the lower esophageal sphincter tone will be finished. So actually you are predisposing the patient for aspiration. That's why it is not recommended to, unless, for example, there is gross ascites or there is gross intestinal obstruction and there are like a prolonged history of obstruction, and then you think that patient will definitely regurge. In that case, maybe you can pass NG tube with risk versus because in that thing, maybe the benefits you can achieve by deflating the stomach out of with gas as well as the liquid component, so which will ease your ventilation, okay, and maybe it will ease your life. But otherwise, NG tube, that's why NG is always problematic. Usually, what you give is metoclopramide, okay, which is What is the mechanism of action of metoclopramide? It
That
is
is a
dopamine.
dopamine antagonist.
Okay, so it has peripheral effect and it acts as prokinetic. It increase the gastric motility. Okay. What other medications you can use to do the same? If, for example, if you have a patient with Parkinson's disease and you want to give something which is not acting on central chemoreceptors, okay, the central like it does not cross the blood-brain barrier. Is there any antidopaminergic which you can use?
So can we give erythromycin that also causes pro-motility drug?
Erythromycin also. Okay, there is one more cisapride, if I'm not wrong, and actually, which I am trying to tell you is the same dopamine anti-dopaminergic, but it does not cause central effect. That is domperidone.
Domperidone, right, sir.
Okay, so domperidone you
Uh,
can,
sir, sir,
yes.
can we use ondansetron?
Ondansetron. What is the mechanism of action of ondansetron, Tayyab?
Five, it acts upon 5-HT3 receptors, which are central as well as peripheral.
Okay, so do you think it will increase the gastric motility?
Sir, yes, I have read one article that 5-HT3 receptors are also located in gut, where it causes increased gastric motility too.
Okay, this is some new information. I need to recheck because, in my opinion, it acts on central chemoreceptor trigger zone, and its main action is as anti-emetic. Okay, so I need to check it, so I cannot comment anything on it. Okay, so actually, you need something to increase, like we are at the moment, because there is two things. One is content, volume. Okay, the other is acidity. Okay, so the volume is 25 ml or 0.25 to 5.5 ml per kg. Okay, around 0.25 ml per kg, and the pH is 2.5. Yeah, less than 2.5 pH and more than 25 ml. This will predispose to aspiration. Okay, so if you want to reduce the volume, first of all, you need to kick out the volume which is present. So for that, you need something to increase the motility. I'm not sure erythromycin, because erythromycin never used as an emergency. In emergency, I have never heard or think about using it. I don't think so. Erythromycin is used because it is used mainly in ICU, not in our anesthesia floor. I have not seen, but yes, it is a prokinetic agent. It is being used to increase the gastric motility. So now for this thing, and you want to decrease the acid production. Okay. So for that acid production, actually you are either using H2 receptor antagonist or uh, PPIs. Okay. So both can be used with anesthesia. I will tell you two thing that cimetidine is enzyme inducer. If I'm just correct me, enzyme inducer or enzyme inhibitor?
Sir, it is inhibitor, cytochrome P450 inhibitor, omeprazole.
No, imiprazole is inhibitor. I know. Okay, I'm talking about H2 receptor antagonist, cimetidine. I think cimetidine is
Cimetidine is also inhibitor.
just can let me. I think if in the meantime, if someone can Google it, because I think it is inducer and it is inhibitor. Just anyone reconfirm about it. So you should be knowing. And for example, if we say it is inducer, for example, anything, and it is inhibitor, what does it mean? What does it mean to us? Yes, please.
Sir, can I say
Yes,
something?
yes. Sure, sure.
Sir, sir, inducer, it will activate the liver enzyme, so it will increase the metabolism, and it will increase the digestion and uh, Sir, also this inhibitors, they will if we P450 inhibitor, that will inhibit the P450 enzyme and it will decrease the metabolism of the uh, substrate.
Yes. So, so it is both of them are cimetidine and omeprazole are enzyme inhibitor. Okay, thanks for correcting me because I was just thinking because actually you see sometimes you only remember the mnemonic. So I will tell you there was a mnemonic crap GP. I don't remember the exactly. When I was preparing for ED, I had made some. So I think this is rifampicin. I don't remember now, which is finished now. But one of cimetidine was here. Rifampicin is here. So they are enzyme inhibitors all. Uh, okay, so this is that like with enzyme inhibitor, maybe it's requirement of some of the medications. I cannot recall what medications exactly, but you can the one who are preparing for basic sciences exam. This is a frequently asked question. Inhibitors and uh, this one inducer and inhibitors. So you should be knowing which are enzyme inhibitors and which are enzyme inducers. Okay, this is a frequently asked question in basic science exams. So you should be knowing about it. So this is one thing because what will happen that it will decrease the pH. Decrease the acid production and increase the pH. Okay. So when
Sir,
pH, yes.
sir, I just want to ask that, sir, I've heard somewhere that I read somewhere this droperidol we can also give for this to reduce aspiration and chances of vomiting.
No, that is haloperidol,
Yes, sir.
droperidol. They are for this is
Antipsychotic medicine,
these are
sir.
for as prevention of PONV. Okay,
Uh-huh.
not
Okay, sir.
aspiration. This is a
Okay, okay.
little bit different because when we will discuss about PONV, there are like their main target is chemoreceptor trigger zones. Okay,
Uh-huh. And sir,
so
this in especially in pregnant ladies, so sir, we are also giving this sir antacid salts. So if chances of aspiration is there, so uh,
okay.
yani, yeah,
Yes, I will about to because we discuss about increasing the motility. We discuss about decreasing the acid production. So now to neutralize, okay, whatever is whatever acid is there, for that one the non-particular antacid, okay, non-particular antacid, sodium. What is the name? Because I have never used it. I have only read about it. Is it sodium citrate?
sir,
I just
lithium salts
no,
is
l-
magnesium
l-
and
magnesium.
magnesium.
Is it? I think these are particulate.
Yes, sir.
Okay, so these are not used. We
Okay.
talk about non-particulate. Okay, and okay, another important thing like this is you should be knowing, and then rest you can avoid GA. If you are avoiding GA, then if you have to give GA, would you choose iGel, LMA, or intubation?
Sir, intubation is best, sir.
Okay. Intubation is best, or you if it is coming like that, it will reduce the chances of aspiration.
Yes, sir.
Now, these words of best and worst are very absolute. Okay, so try to use because you will find in MCQ question in which there will be statement like that it reduces the chances. Just tell
Yes,
me
sir.
one thing, which endotracheal tube will have better chance, cuffed or uncuffed?
Sir, cuffed one has better chance
Okay.
to. Yes, sir.
Uncuffed will still will have chance because you are not
Yes.
sure it completely sealing or not. Okay, so because still there can be aspiration of material through the cuff if it is ruptured, or it can penetrate through small space in between. So it is not, you can say, 100% preventing it. Okay. If someone asks you about 100% prevention, that is only to put a throat pack, because throat pack will totally seal that area and nothing will go down. So if you want to prevent from aspiration, the absolute thing is throat pack. I don't know why people don't use it, but in my minor understanding, if you after intubation you put throat pack, maybe this can prevent in a better way. Okay. Yes, Abdul
Sir,
Rafi?
double lumen tubes are also used somewhere, but
No, 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 no.
I think
Double.
no,
No,
sir.
no, no. No, no, no. Double lumen
Okay,
tube
sir.
is nothing. Double lumen is tube is for one lung ventilation, not for prevention of aspiration. Okay.
Okay, sir.
Okay, so you will secure the airway, of course. You will not do it with
Sir,
ILMA or
excuse me, sir.
HIGEL. Yes.
Sir, I wanted to ask that is it throat pack with a cuffed endotracheal tube or just a throat pack?
Throat pack, actually, this is, I have not read it anywhere. This is, I'm just telling you a theory. So if I don't tell you something which is according to the data, please don't tell in the exam. Practically, I can guarantee you this about this thing, that practically, if you want to prevent from aspiration, if you put the throat pack, that will be why you put throat pack in ENT surgery. Whenever you are thinking that blood can trickle, so
To
that is the
decrease,
reason,
right, sir?
because
Exact.
okay, so that's why,
So,
and
sir,
other
what answer should we give in the exam?
in the exam, it will reduce the chances. Okay,
Throat
because
pack
I
will
cannot
reduce the
comment,
chances.
I don't want to tell you something which is not in the text. I never read this thing. I don't know, maybe I don't know why people, maybe there is because there is a counter argument, because if you place throat pack, and now I will just tell you what other factors which can predispose to regurg actually. It is one of them is actually throat pack at the end, in the sense that you are, if you remove the throat pack when the patient is light, actually it will irritate. So there will be more chance. Similarly, airway. People are in habit there, because there is a big debate with a number of people. I have seen majority of people placing an airway with the endotracheal tube, even they cuff it, they tie it with it. So it's a terrible thing, in my opinion, because you are constantly irritating the airway. If any time your patient becomes light, one tube is there, and you have placed something in between. The tube is directly gone inside, so it is not irritating as much as the airway will do. So if patient becomes in light plane, the airway will become a big trouble for you, because it will irritate and it can cause so I don't know why people do it, because if you want to prevent, we discussed previously as well, that if you want to prevent the endotracheal bite with the tooth, with the teeth, okay, so then you can place a bite block in between. Just take a gauze, roll it, and just put it in between. This is one way. Other way is you put yanker. Okay. But please, in the exam, of course, because I have not seen written in any book that you can use yanker as an airway, but practically, I never ever use airway. I never ever use airway, and I've always use yanker for this purpose. If I think that patient will bite the tube, I just keep the yanker between the teeth. Okay. Anyways, this is practical thing. Anyone can argue. Anyone can have different ideas, but I'm just telling what I do. Okay. So if you
So we
will
can
try to
also
do
put a
this,
5 cc syringe.
sorry.
Sometimes we place 5 cc syringe
Your
in
voice is
between
coming
the
very
muscle.
low. Please, can you be a little loud, Pardeep?
Sometimes we can place 5 cc syringe in between teeth
I
to prevent.
apologize. Maybe you can write, because your voice is not audible. Okay. Anyways, we will just proceed with
5 cc
the
syringe, sir.
yes, 5 cc syringe. Thank you very much. 5 cc syringe we can do. Okay. Breaks into sharp splinters in case the patient bites it tight. Yes. Yanker break. Actually, the good company yanker cannot be broke. If the patient is becoming so awake, you can give propofol. If the situation becomes like that, you are absolutely right. There is one this I have never seen it, but theoretically, actually, there is one sort of yanker which is sharp ended. There is another yanker which is blunt ended. The blunt ended yanker is a very good quality. It cannot be broken. I can guarantee. There is another quality which can be broken. You are absolutely right. There is and that end is actually a little sharp. Okay. Another thing I will just as Tayyab mentioned, head elevation 30 degree will also work, because it will because as I mentioned this thing in the RAM position discussion, that it is always helpful. Okay, because it will decrease like the the gastric content needs to go uphill to come. Okay, so anyways, these are some basic concepts. And I have a question, that why Allah has placed chemoreceptor triggers even outside blood brain barrier. Can anyone tell?
Uh, Nauseous stimuli uh,
Ve-
can be
ve-
detected outside the brain.
Very good. So the basic theory is that if someone has taken something poisonous and it entered somehow in the body, the patient will vomit. So that is the purpose, that chemoreceptor trigger zone is outside brain. So it try to prevent things entering in the brain. This is so there are so many receptors. Different theories have been postulated. So now if we talk about prevention of nausea, vomiting, so the medications which are being used are one of them is dexamethasone. Mechanism is unknown. No, but probably it has some action on chemoreceptor trigger zone. Ondansetron, as we discussed, it acts on serotonin receptors, 5-HT3 receptors, and just mentioned by Tayyab, he read somewhere that it acts on the peripheral receptor. I have no idea. So I only think that it is for, even initially it was introduced for chemotherapy related vomiting. Okay. So chemotherapy induced vomiting was controlled by ondansetron. If, for example, even ondansetron fail, do you know what medications being used as antiemetic as a last resort in terminal chemotherapy or terminal cancer patients? Do you know? Can anyone tell? That medication is our dear propofol. Propofol infusion is being used as a last resort, in low dose in a patients who are not tolerating. It is actually as a part of palliative therapy, as like you can say, you are easing out the patient. Let's say patient is alive but a little bit sedated because of pain and because of vomiting, and this is one of the modality. Okay, so propofol has antiemetic.
Sir,
Yes,
sir, it also has antiemetic effects also, no?
yes,
With
it has
with the sedation and everything else.
yeah, yes, it has antiemetic effect. You are right. Okay, so so actually ondansetron, propofol, then as you told, haloperidol. Haloperidol is also for one other condition. What is that? It is recommended drug for
Emergence delirium.
very good emergence delirium. It is the drug of choice. Okay, so another thing. Then actually now if we just chalk out that which anesthetic factors can increase the chances of postoperative nausea, vomiting. So one of the biggest factors, neostigmine. Okay, then inhalational agents, nitrous oxide, and my new enemy, opiates. Okay,
Then
what
mask
else?
medication.
Anything else?
Sir,
Ventilation.
type of surgery and duration of surgery.
Very good. I am talking about anesthesia factor. We will go to surgical factors as well. But what about anesthetic factors? Anything else you can recall?
Pain.
Very good. Pain. I will add one more thing which is important as an aesthetic factor, or you can say that if there is prolonged NPO or there is less fluids you gave to the patient intraoperatively. So that is one of the biggest factor for post-operative nausea vomiting. Okay. So if you hydrate the patient, yes, the hypotension. In hypotension, it will occur. Okay. So like this is this. Okay. When if you talk about surgical factors, this vagabond, wherever this is there is chances of nausea vomiting. Okay. So vagus nerve involvement, there will be chances of vomiting. Then another thing is that because the vestibulocochlear nerve area, like you can say that vestibular system, the balance system, whenever they are playing with that, so middle ear surgery, okay, middle ear surgery, there are more chances. Which other surgery have more chances? We will just try to have, because we are getting short of time. I will just try to show you some of the text which I just wanted to show you. Okay, so this is just signaling how it is being controlled. What is the mechanism of vomiting? Okay, uh, how it is being controlled. The medications that like they have just mentioned the pathways. Okay. Anesthetic factors, I told you, inhalation agent, nitrous oxide, opioids. Okay. TIVA will reduce the chances. Dehydration will have mass ventilation of when you insufflate. Then surgical laparoscopic surgery, again, any surgery with the vagal involvement, here squint surgery. There is a reflex which is called as oculoemetic reflex. Oculoemetic reflex. So that is one of the cause after squint surgery. Afferent efferent is almost the same as oculocardiac reflex. Okay. Okay. So female gender is a risk factor. Okay. Female gender is a risk factor. Use of opioids is a risk factor. Previous history of PONV is a risk factor. Okay. Motion sickness is a risk factor. History of sickness with chemotherapeutic agents is a risk factor. Do you know smoking? It reduces. So if you are a smoker, there are two things. One thing is PONV. What is the other thing? If you are a smoker, there are only two things for which you are less chances. One, less chances of PNV and less chances of Parkinson's disease. What is PIH? No. Parkinson's disease. Okay. So if you want to be prevented from Parkinson's disease, start smoking, please. Okay. Apfel score. This is the Apfel score. Okay. For prevention of nausea, vomiting. Sorry, the risk factor, just to chalking out the risk factor for nausea, vomiting. So, just a second. Where are the factors they have chalked out? These are the factors. The foremost is to, yes, female gender, non-smoker, perioperative opioids, and previous personal history of PONV or motion sickness. Okay. So if you have these things and you have zero score, 1, 2, 3, 4. Okay. So if you have zero, still you have 10% chances of PONV. If you have 1, 21, 2, 39, like that. Okay. So this is some other score. What is POVOC? For use in children. Most. Okay. Okay. So here, what are there? Duration of surgery more than 30 minutes. Age over 3. Strabismus surgery. And person or family history of PONV. and the number of risk factors correlate to the incidence of PONV. Okay, so actually this is something new for me as well. I have never when we studied before, remember this Apfel score, this is for adults, I think, and this is for children. Okay, so you can have these articles are there in the articles folder in complications, and then you will find PONV. Okay, so here they have, I think, chalked out some of the, this is the mechanism of actions and side effects. So ondansetron has relation with QT prolongation. So ondansetron you will not use. Can anyone just recall some of the medications which can cause QT interval prolongation? Aminoglycoside, amiodarone, okay, lithium. So you should learn like this. These things are correlated. You should be thinking if you have a QT interval prolongation, you will not use ondansetron. The common medications which you use, you will not, among those you will not use, because you see droperidol also QT antipsychotics also cause aminoglycoside, as I told you, also do. Okay. So what else? Droperidol. So antihistaminic, they have effect in the treatment of motion. If the patients have nausea, motion sickness, you will also use, which we have not discussed up till now. One of them is antihistaminics, and other is, which is the other medication which is used for motion sickness. Can anyone tell?
Cyclizine?
No. Other group, not antihistamine. Scopolamine. Okay. It's hyoscine.
Right, sir.
There is
Right,
a hyoscine patch which is being used for the prevention of motion sickness. And this is one other medication, which is not written in all books, but this is something new. It is apripitant. I don't have much idea, much information about it. It is NK1 receptor antagonist. Okay, so you can find this in your MCQs. This is a new medication. It's not available. I don't know. I have never seen about it, but you can read some because if the people they are looking for something new, this is one of the question which can be asked. Okay, you can Google it. The medication which I remember I have told you, aminoglycoside, this one, this other few medications I have told you, which can increase the. Can you, Dr. Shamim, can you please stop your video? Okay, thank you. Drug of choice is to control the vomiting is the patient has PONV. Sir, somewhere I have studied, if patient has PONV, the drug of choice to control the vomiting is promethazine. I doubt. If motion sickness, with reference to motion sickness, it is because promethazine, it is coming as the name of Stamatil, if I'm not wrong. So Stamatil, yes, it is a powerful antihistaminic which is being used for nausea vomiting, but drug of choice, I'm not sure, because drug of choice for onden is actually ondansetron, and if you have more risk factors, you will use two agents. Okay, that's why usually all of us give ondansetron as well as dexamethasone usually in our practice. Okay, so the people who are preparing for basic sciences exam, you can have a look on the vomiting. I don't remember because I'm short of time now. I want to finish the discussion. I just want to tell you few more points. We will see. Maybe we will find here, as Tayyab was mentioning about this thing. So if there is PONV, patient will be in distress, dehydration, aspiration risk can still there, increase analgesia requirement, decrease oral intake, non-compliance with medication and nutrition, disruption of surgical wounds, delay hospital discharge. Okay, late mobilization. That is why PONV should be treated aggressively. Okay, as aggressively as pain. You should prevent it always. You should prevent it. That's why if you reduce the use of inhalational agents, and of course, like I do, I have reduced or almost deleted opioids from my practice as much as possible. I hardly use opioids. I try to use other medications. Okay. So, okay, that's it. There was an article about aspiration. Actually, this was an article which I did not find when I opened for PACU. I will share this with you as well. So this is few words about aspiration. We discussed about aspiration. Okay. So any condition in which the conscious level is deteriorated, the airway open, thus anything which is creating more problem in the increased pressure, okay, in the air when you are ventilating the patient, or so that will be leading to aspiration. Okay. So as they have written here, conscious level problems, here it is. Just a second. Okay, head injury. So we discussed about cricoid pressure and aspiration prophylaxis before. That is the technique which actually I prefer with rocuronium higher dose. Don't ventilate the patient. Okay, pre-oxygenate with deep breathings. Okay, and then if you are giving rocuronium in a higher dose, if you have Sugammadex, if you have any problem with the intubation, you can immediately reverse as well. Okay, so that's it. You will find very good information about uh, everything in the articles. And actually, this source is not familiar to a number of people. Uh, when there is aspiration, actually, there is one or two terminologies which they use. One of them is aspiration pneumonia, and one is aspiration pneumonitis. And pneumonia is when infection is developed. Pneumonitis is the Mendelssohn syndrome. Okay, so this is the one which is documented here as Mendelssohn syndrome. Okay. So pulmonary aspiration, inhalation or overcut into the airway below the. So okay, if in the aspiration there is content of fecal, then you need antibiotics. Otherwise, sterile. It is if it is sterile, there is no fecal. Antibiotics are not recommended. Steroids are not recommended. You just do the ventilation with PEEP, okay? And maybe you need to have bronchoscopy, okay? And a lavage to remove if you find any particles. That's it, okay? So any comments? Stamatil is prochlorozine. Okay. I was wrong. Okay. Phenergan is promethazine. Actually, uh, these medications are not freely available in Saudi Arabia, so I'm just out of practice with Stamatil and Phenergan. And do you know Phenergan is the most favorite medication for newly made mothers? Do you know this Phenergan? Because Phenergan is unfortunately utilized by a number of mothers to calm down their kids because it sedates the patients. Okay. So thank you very much, all of you, for your presence. And inshallah, we will discuss some of the basic topics for, if you want to have some details, you can have a look on the NAP4. Okay. I think it's there in my link. I will upload it, the video, and you can see it. Thanks a lot, all of you. This actually, again, I repeat something that since I resumed, I'm just trying to cover the basic anesthesia topics, which are actually easy for me to describe because actually, I'm not in study mode. If I want to prepare a topic thoroughly from all the aspects, actually, I need to read myself. So unfortunately, because I'm just trying to give as much I have, whatever I can recall, I just discuss with you. And my basic aim is that if someone has given you a correct insight of the concept of the topic, rest you can read. All of us can read. The problem is that sometimes we don't know what are more important things and what are the priority things. At least when I read, when I remember, I had this problem that I don't know which is what thing may be asked. So actually, unfortunately, MCQs. I'm sorry, I'm not a MCQ guy. MCQs, for MCQs, actually, you need to read some books. Okay, MCQs books, and if you, my theory to helping all of you is that if you have the correct concept, believe me, then MCQs will speak out to you that what is the answer. They will give you some hint. What is the best and what is the first, maybe different. The answer will be different in what is the best thing to do or the what is the first thing to do. The answer will be different. Okay, so try to read the MCQ. Unfortunately, because it's in the my suggestion, whenever you are in the exam and you are reading some MCQ, first of all, please don't try to recall it that from which book it is coming. Because if you are predetermined before you start attempting the question, unfortunately, you will be distracted. If you have something predetermined, maybe it is that question. Maybe I discussed and this was the answer. This, because it is never sure that whosoever is reproducing the questions may be right. Okay. It's not possible to reproduce all the parts of the question uh, when you recall then, because people are in habit of recall cramming. There is a holy textbook of Aisha Beg MCQs. There is a holy textbook of MCQs which are there. Unfortunately, you people are distracted. Even if someone is passing with those crap MCQ pool, I'm not sure what he is thinking, what is his future. Okay, so this is wrong. Yes, you should do it, but in a way that you just repeat, just try to grab the topics which are important. Okay, so maybe the topic which was asked in that MCQ, try to read the whereabouts at that topic rather than cramming the answer of that MCQ. There are so many people who are claiming that this is the previous pool, crammed it, exam, pass the exam, and then after that knowledge will come in years. You will never study, believe me, and you will regret that why you pass. Maybe the best example is me. If I had passed my exam in first time, maybe I did not face that pain and trouble which you people, number of people face when they fail in the exam. So maybe I had, if I, because I have tasted that pain, that's I know, because I passed. I told you that I passed my FCPS exam in my last attempt of Viva. Like it was my last attempt. If I had failed, I would need to repeat my written part again. Okay. So that's why I will tell you, please don't try to have shortcuts. Okay. Try to learn in a way that it is durable. If you have the correct concept, these substandard questions will be there in any part of the world, but they will be around 5 to 10%. Maybe if you think that in your system it is more, maybe our Pakistani friends, they are worried that the question pool is not good and this and that. Believe me, I have also passed through that. The exam is not like that what people describe, and it is the same. Maybe people senior than me will say our exam was very difficult. I will never say like this. The exam will be same because the same system is there and they are maintaining the system. Okay, so unfortunately, you don't think about what is the status of the questions that they said. There is something which you are missing, and because you are, why you are missing, because you are trying to reproduce the knowledge which you have grabbed from those crap MCQs pool. So I will request you, just take the topic which is being discussed in the previous MCQs pool and learn that topic. Okay. So thank you all of you for your presence. And inshallah, I will just think, I don't have any topic in my mind. If anyone wants to discuss any topic, you can just message me. I will try to do that topic. Okay. Thank you very much. Inshallah, we will meet again. And thank you, my dear class fellow. My what is this? Pass MCQs are the most high yield. It's just they are poorly recalled that they become harmful. No, actually, remember one thing. In all over the world, you have MCQs recall and MCQs pool. If you will try to worship it, then it will create a problem. Okay. The problem is that people try to worship it. People try to forget that the person who has recalled has not received the PDF from the examiner. It is only the recall. So they have a lot of mistakes and nobody can recall all the questions. I can guarantee you. If you think that you can recall all the MCQs, then you are not a human being, you are a machine. So try again, I repeat, try to take the topic and try to read that topic. If you have multiple options, don't believe that someone's saying this is in the key. I can bet you why, because the person who is claiming this is the bloody person that has passed the exam. Only that case that he is claiming that because I passed the exam, so whatever I am saying is the authority. He is never sure. We never get the exam result at our home like we get in the class 5, fortunately or unfortunately. Okay, so nobody can claim that because I am saying that this is in the key. I'm sorry, this is wrong concept. You are never sure. If you have any doubt, check Google it, Google the answer, and then Google all the information which was being asked in the question. Unfortunately, because we try to bypass these things and we try to have something shortcut. Okay, so there is no shortcut to glory. Please remember this thing in your life. There is no shortcut. Okay, my dear friends, thank you very much. See you inshallah tomorrow. Assalamu alaikum.